Welcome to the American Lung Association's Tobacco and Nicotine-Free Childcare Webcast. We are happy you are here with us to learn more on this initiative and how you can personally take the steps to update or implement your tobacco-free policy. Through this presentation, you will be able to define what tobacco and nicotine products are and be able to identify these products. Also learn about the health effects of tobacco and nicotine use. Understand all of the components to meet the Iowa Department of Health and Human Services standards for a comprehensive tobacco and nicotine-free policy. And lastly, implement and enforce a comprehensive policy at your child care center or home. The American Lung Association in Iowa serves as a community partner for the Iowa Department of Health and Human Services Tobacco Use Prevention and Control Grant. The map on the right shows all 8 counties that we serve highlighted in green. These counties are Adair, Dallas, Jasper, Madison, Marshall, Polk, Union, and Warren. Community partnerships exist in every county in Iowa that deliver services to their community to help prevent youth from starting to use tobacco and nicotine products, help those who use tobacco quit, and protect non-smokers from the impacts of secondhand and third-hand smoke. One of these initiatives is tobacco and nicotine-free childcare. We will discuss more about the specifics of this initiative later, but policy is a large part of the work that we do. While we specifically serve an area of the state, initiatives are all statewide. If you are not located in one of our counties, feel free to use the link on this page to find out who your local community partner is, or send us an email and we would be more than happy to connect you with your community partnership to provide resources or assist you in creating or implementing a policy for your childcare. Now let's take a deeper dive into tobacco products themselves and break down what exactly this product is and how it is utilized. A tobacco product is defined as any product made or derived from tobacco or that contains nicotine that is intended for human consumption or is likely to be consumed, whether smoked, heated, chewed, absorbed, dissolved, inhaled, or ingested by any other means. This often includes, but is not limited to, a cigarette, cigar, pipe tobacco, chewing tobacco, snuff, snus, pouches, and e-cigarettes. We will talk a bit more about e-cigarettes in the next coming slides, but know these are tobacco products and fit within the Food and Drug Administration's authority to regulate as such. It is also important to note that this definition does not extend to nicotine products approved by the Food and Drug Administration for tobacco cessation. What this means is that if someone were using a nicotine patch to help them quit tobacco, they would not be violating a comprehensive tobacco and nicotine-free policy. We want to make sure this is included in a policy to protect those who are trying to quit using these FDA-approved cessation products. Our definitions are also comprehensive, which means that all tobacco products are covered and intended to include all products that have not hit the shelves or market yet, or potential new products that are working to be developed. Here are some examples of tobacco products themselves. Starting with picture number 1, which is probably the most recognizable to individuals, combustible cigarettes. Picture number 2 is Swisher Sweets Blunts or little cigars. Many times these products come in smaller packs and are flavored, which is very attractive to young users. Picture number 3 is a newer product that is called Heat Not Burn or IQOS. This product is slowly making its way onto US markets. Picture number 4 is a hookah device that uses charcoal and water to burn tobacco to ingest. Picture number 5 is chewing tobacco. Pictures 6 and 7 is snus, which is loose tobacco that does not require spitting, another form of smokeless tobacco. Picture number 8 is flavored cigars that again come in a variety of flavors that strongly appeal to youth. Many of these products may be recognizable. With new products like vaping devices, they are getting harder and harder to recognize. Let's look a bit more into electronic smoking devices themselves. These products are the newer tobacco products on the market that have certainly gained extreme youth appeal and use in recent years. Electronic smoking devices is an umbrella term that's used to describe a variety of electronic devices that usually contain nicotine, flavorings, and other additives and oftentimes simulate smoking. You may also hear words like tanks, vapes, e-cig, mod, e-cigarette to describe these devices. There are a variety of these products on the market, and they are beginning to look anything like a tobacco product. The picture on the right shows one of the first generation e-cigarettes that resembles a traditional combustible cigarette. Through the years, these products have now changed to be almost unrecognizable and look like everyday items. These devices are highly customizable and mimic the behavior of smoking. The tobacco industry uses the term water vapor to make people think these devices are safe, when in fact it is an aerosol that is released from these products once the liquid is heated. However, the impact around which the American Lung Association is concerned is for both youth and adults is the impact of inhaling these chemicals and the impact directly on the lung. This slide shows the extreme evolution of these products from resembling traditional cigarettes to looking nothing like tobacco products. This is not by accident. Current products have become more easy to hide, disguise, and resemble other products in our lives, which has a high youth appeal. We have seen this in the rates of youth using these products that have been never smokers or would have ordinarily been a never smoker. Here are a few more pictures to provide the landscape of the look, size, and shape of these products. They are now becoming to resemble items like USB drives, lighters, and technology products we see in our everyday lives. While it may be difficult to recognize every brand and device, all of these products have a device mouthpiece, chemical-filled e-juice, and are battery-powered that powers the device. We see also that they've turned to using products that resemble apparel, such as Apple Watches, and hoodie clothing. With the high appeal of these products among youth, we saw a significant uptake in youth that are vaping. In 2018, the Surgeon General cited youth vaping as an epidemic. Because of the youth epidemic that was created with vaping devices, we are now finally beginning to see regulation take place on these products. However, with regulation also comes big tobacco trying to find loopholes to continue selling their addictive products. Recently, we have seen the evolution of nicotine derived from tobacco to the use of synthetic nicotine, and marketing terms like tobacco-free being highly utilized. This creates even more confusing to users or potential users. Let's talk more about what these terms mean and the products that are using these specific terms. First, let's take a look at a recent marketing tactic of being labeled products as tobacco-free. These products are nicotine products that are derived from tobacco plants but does not contain the tobacco leaf itself in the product. So these products still contain nicotine and are not synthetic-based nicotine because they use nicotine that is derived from tobacco. This terminology is misleading to consumers as they are marketed as clean and pure. Users may think they are getting a safer option because the product is marketed as tobacco-free when it is in fact a nicotine derived from tobacco product. This continues the confusing tactics of the tobacco industry to try and trick consumers into purchasing their product and continue to hook people on their product. On this slide specifically, we see nicotine pouches, nicotine lozenges, and nicotine gummies. Recently, the company pictured below selling nicotine gummies discontinued their product due to warning letters submitted from the FDA. Now let's take a look at nicotine specifically. We mentioned the term synthetic nicotine in the previous slides and want to touch base on this product. We are also seeing the switch of e-cigarettes from using tobacco-derived nicotine to synthetic nicotine. The biggest difference between the two is one is extracted from the tobacco plant itself and one is created in a lab. Synthetic nicotine is a lab-made substance that is not derived from tobacco. With utilizing lab-created nicotine, it exploits loopholes in current product regulation. However, in the summer of 2020, Congress signed a law giving the Food and Drug Administration the authority to regulate synthetic nicotine products, and that these products fell within the current tobacco regulation standards. However, we are currently seeing deadlines not be followed for these products and them continuing to be on the market. This is going to be something we watch to see how these products are regulated in the future and change the landscape of electronic smoking devices. Reviewing electronic smoking devices provides a background as to why is it important to include these products in a tobacco policy and how these products fit into a comprehensive tobacco and nicotine-free policy. It is also helpful to have a basic understanding of these products for implementation and enforcement of a comprehensive tobacco and nicotine-free policy. Now let's take a look at the health impacts from tobacco and nicotine products. So what is secondhand smoke? Secondhand smoke is the smoke that is produced directly from a combustible tobacco product. Secondhand smoke is the smoke that individuals inhale as they walk by someone using a tobacco product or are around someone who is using a combustible tobacco product. Secondhand smoke contains over 7,000 chemicals, many of which are known to cause cancer. There are serious health concerns with individuals who are exposed to secondhand smoke, and a big reason why having a comprehensive tobacco and nicotine-free home and business is so important. When looking at third-hand smoke may not be as familiar to individuals as secondhand smoke is. Third-hand smoke is the nicotine residue that has settled on surfaces after an individual has finished using their tobacco product. Third-hand smoke can be found on clothing, furniture, inside vehicles, and many other locations. Third-hand smoke builds up over time and becomes embedded in these surfaces long after smoking has stopped. Like secondhand smoke, third-hand smoke residue also contains over 250 harmful chemicals. Third-hand smoke cannot be eliminated by airing out rooms, opening windows, using fans, or continuing to smoke only in certain areas of a home. Third-hand smoke poses a health hazard to non-smokers, especially children, when they touch or breathe in contaminated surfaces. There are many known adverse health effects of inhaling secondhand smoke. These negative health effects are listed on this slide. You can see health effects for both adults and youth and young people. These conditions can be avoided by limiting exposure to secondhand smoke and asking individuals to not use tobacco products around you. Secondhand smoke exposure for non-smokers is a huge reason to implement a comprehensive tobacco and nicotine-free policy. By eliminating tobacco use on your grounds, you minimize the risk of exposure for secondhand smoke, third-hand smoke to non-smokers. Like secondhand smoke, the aerosol produced from e-cigarettes is also harmful to non-smokers. E-cigarette secondhand aerosol is composed of the same harmful chemicals, including heavy metals and flavorings linked to lung disease, and several other cancer-causing chemicals. These devices also produce ultrafine particulates that penetrate the lungs. Exposure to these particles may worsen health conditions like asthma and other respiratory conditions. If someone is vaping in the same area as you are breathing it in. Because these products are relatively new in terms of using science to show long-term usage effects, more evidence is likely to become available that show more association with respiratory conditions, cardiovascular disease, and more. On this slide, we see components of what is included and what chemicals are in an e-cigarette aerosol. So far in this presentation, we have defined tobacco products as well as secondhand and thirdhand smoke and secondhand aerosol. The remainder of this presentation will focus on tobacco-free and nicotine-free environments and how to either implement a policy or enhance a current policy for your child care home and/or center. The American Lung Association has a model policy that we are more than happy to share with you that you can implement, or we can take a look at your current policy and see if anything needs to be added for it to be comprehensive. We provide free technical assistance that includes assisting you in writing a policy that works best for you, as well as free resources, incentive items, signage, education for your childcare, and advertising. Let's walk through why a policy is important and successful steps for implementation. So you may ask yourself, why tobacco and nicotine-free? A tobacco and nicotine-free policy prohibits the use of all tobacco products we previously mentioned at all times and applies to the entire property and/or grounds. It is important for the policy to be effective 24/7 because it protects not only employees but everyone from secondhand and thirdhand smoke, and it also motivates tobacco users to potentially quit. So why not have just a smoke-free policy? A tobacco-free and nicotine-free policy protects everyone from secondhand and thirdhand aerosol of electronic smoking devices. A policy also encourages current users to quit instead of switching to another tobacco product. So now that we really know why tobacco and nicotine-free, let's take a look at more of the support and rationale for a comprehensive policy. The first thing you as a provider may wonder is if there is support from other agencies and the community for a tobacco and nicotine-free policy. The answer is definitely a yes. Numerous public agencies support making child care policies stronger than the state law to protect both employees and families. Additionally, parents want their kids protected from the effects of tobacco and also want a healthy example set for their kids. A comprehensive tobacco and nicotine-free childcare is something that is strongly supported. The comprehensive tobacco and nicotine-free policy that I am talking about today is stronger than the one described by the Iowa Smoke-Free Air Act, or what was referred to as the state law in the previous slide. The Iowa Smoke-Free Air Act went into effect on July 1, 2008. The Smoke-Free Air Act prohibits smoking in enclosed areas within places of employment, as well as some outdoor areas. The Iowa Smoke-Free Air Act does not apply to electronic smoking devices. Part of the reason for this is the law has not been updated since 2008, before these products grew in popularity in the state of Iowa. This is why implementing a comprehensive policy is important, to cover holes in the state law. On this slide, you'll see specifically what the Smoke-Free Air Act prohibits when looking at child care facilities and home. We see that smoking is prohibited anywhere within a facility, smoking is prohibited at all times, whether children are present or not, and then smoking is prohibited in any vehicle owned or leased by the manager of the child care facility. Let's walk through the importance of a tobacco-free policy along with steps to implement a policy successfully. There are several reasons implementing a comprehensive tobacco-free policy is beneficial for both employees and employers. There are 3 reasons to implement a strong, comprehensive tobacco-free policy at your workplace. The first reason being updating existing smoke-free policies. It is important for a child care center to continue implementing a policy or consider implementing a policy that is stronger than local state law, or in this case, the Smoke-Free Air Act. As previously mentioned, the Smoke-Free Air Act leaves gaps in products that it covers, along with areas where tobacco use is prohibited. Reason number 2 is improving the health of all employees and visitors. This reason is important for all of us, knowing the detrimental effects of tobacco use. A comprehensive policy promotes clean air for all to breathe, removes potential exposure to secondhand smoke, and creates an overall healthier center or home. The third reason is really to reduce employer costs. We will break this down later, but with breaks, productivity, and potential healthcare coverage, these costs all add up for businesses, big or small. Let's take a look at reason number 1, updating existing smoke-free policies. Tobacco and nicotine-free policies are a priority because employees or visitors that smoke may replace their cigarettes with smokeless tobacco or non-FDA approved nicotine products for cessation during times when smoking is prohibited. An example would be if an e-cigarette are not prohibited in a policy, employees may freely use these products in office or externally rather than smoking or quitting while at work. We want individuals to quit and not to switch. It can also create confusion if gaps exist for what is and what is not allowed on a property. A comprehensive policy creates a clear and uniform policy where all products are not allowed rather than some are and some are not. Additionally, for reason number 1, updating existing smoke-free policy, we see benefits like protecting children from secondhand and third-hand smoke exposure and/or aerosol exposure, preventing nicotine poisoning from tobacco products or tobacco product waste, preventing children's exposure to products to promote healthy social norms, and making sure tobacco and nicotine-free policies are a priority. The second case is to improve the health of employees and visitors. The current adult tobacco use rate in Iowa sits at 15.8%, which is higher than the national rate of 14%. We have come a long way to reduce tobacco use, but still have so far to go, knowing smoking is the leading cause of preventable death and disease. We see nearly 1 out of every 5 deaths in the U.S. is tobacco related. Lung cancer is the leading cancer killer in both men and women, and smoking, including exposure to secondhand smoke, causes 87% of lung cancer cases, and 1 in 10 people with lung disease have never smoked. Smoking kills more than alcohol, AIDS, car crashes, illegal drugs, murders, and suicides combined, and thousands more die from tobacco-related causes such as fires caused by smoking and smokeless tobacco use. This is why it's important to address comprehensive and tobacco-free policies at your childcare to make a healthy environment for all. A comprehensive policy also significantly impacts the work environment and experience for employees. We see that nearly 70% of tobacco users want to quit. An environment that eliminates triggers helps increase the chances of someone successfully quitting. If someone is trying to quit, they may find outlets such as going for a walk or sitting outside to combat cravings. But if they have to walk through a smoking area or individual smoking, they may relapse in their quit attempt. A comprehensive policy can create one element of a supportive environment for those who are looking to quit tobacco. All workers are also protected from secondhand and smoke exposure, and these policies enhance overall health and wellness of employees. We do see that according to the Community Preventative Services Task Force, tobacco and nicotine-free worksite policies reduce consumption by continuing smokers, increase smoking cessation attempts, increase the number of workers who successfully quit, and reduce the prevalence of tobacco use among workers, which all improve the health of our employees and/or visitors. With reducing employer costs, we see that approximately smokers miss 2.6 more days of work than their non-smoking peers every year. It's important to note that while every person is different, a study estimated that the average smoker takes 2 15-minute smoke breaks per day in excess of regular scheduled breaks and allotted breaks. So we see about 5.5 days missed due to these breaks. A tobacco user can start to feel withdrawal symptoms within about 30 minutes of their last tobacco use or cigarette. It is these withdrawal symptoms that can interfere with an employee's ability to effectively perform their job. It is estimated that a smoker is 1% less productive than a non-smoker. This results in around 2.6 days of lost productivity. Lastly, a study estimated that the healthcare expense of a smoker is approximately 8% higher than the expenses for a non-smoker. Smokers are likely to have more insurance claims and could require employers to pay higher insurance premiums. So we see how implementing a tobacco and nicotine-free policy for your child care center and/or home could have significant impacts on the cost to the employer. There are many reasons to implement a tobacco and nicotine-free policy. Here's a list of benefits that are specific to an employer. We see things like conveying a positive image, increasing the resale of a business or building, reduce fire risk, and also increasing productivity for the workplace. Things like a positive image are especially important when to consider a tobacco and nicotine-free child care center and/or home. Many families have the high appeal of a tobacco-free policy when it comes to their child care center and/or home. So I've gone over a few reasons to consider making your child care center and/or home tobacco and nicotine-free. Those reasons were to upgrade smoke-free policies, improve the health of employees, visitors, and clients, and to save money. If a tobacco-free policy is right for your child care center and/or home, it's time to begin the policy planning and implementation process. Some of these steps may work or may not, depending on the size of your location, but we're really here to help modify policies and these steps to fit your needs. Let's take a look at some of these steps. We now know the benefits of a tobacco and nicotine-free policy. However, the big question is, how do you actually go about implementing a policy change? That is where the American Lung Association and community partners come in. One of the biggest questions we receive is, when should this policy change take place and how? It really comes down to a few steps in a detailed timeline, which we will go over. We can work with each individual business, child care center, and/or home to create a specific timeline for your needs. Every place is different and has different needs. We will work with you to decide what is best for your child care center and/or home. When planning a policy change, it's best to have a plan. The first step to take after you have decided to move forward is to determine the messaging that you will be utilizing and an implementation date. If you are still unsure about a policy, you can conduct a survey for employees and families to learn more on the support or concerns they may have with a policy. This could also be a good tactic if you have personally decided to move forward with a policy but want to increase employee and family buy-in and participation in the process. After determining a timeline, you can work to develop messaging and move forward with implementation. Other steps to consider in this phase are potential health insurance coverage of FDA-approved cessation medication, if applicable. Did you know that the Affordable Care Act mandates that most health insurance plans cover preventable services and tobacco intervention, which is defined as preventative? This includes tobacco use screening and at least 2 cessation attempts per year, which includes counseling sessions and treatment regimen of FDA-approved medications when prescribed by a healthcare provider. These are especially mandatory when the employer requires tobacco cessation counseling programming in order to receive an incentive. Employers knowing their medication coverage is an important guide to provide them on their quit journey. A significant piece of the implementation process includes providing employee education on what the policy entails and when it will take effect. We cannot stress enough how important it is to educate your employees and customers and visitors and families. This can be accomplished via mailings like a postcard, flyer, or letter for employees and parents, including it on the website, or including information in new family packets or new hire packets. Community information is also very important. Letting the community know about this important change is important as well. Perhaps posting an article in your local newspaper or adding a post to social media. Information should be communicated often and in different arenas. It must be clear to all employees and visitors what the policy covers to lessen violations of the policy occurring. It should also be communicated what expectations are for the employees. Do they report violations to management? Do they ask people who are using tobacco products to please refrain? This is a great place for FAQ documents to be clear to employees and managers their role in enforcing this policy. Also, cessation information and programs should be provided to employees and families, giving them time to work towards quitting before the policy takes place, or having their quit date align with the policy implementation day. We really want to set them up for success. Next, you will need to remove all smoking huts, ashtrays, receptacles, and hang signage. By leaving tobacco receptacles, it makes it appear tobacco use is acceptable on the property, and signage will help assist with enforcement of the policy itself, making it more visible to visitors. After the communication phase, it's time for implementation. Businesses may choose to have an implementation day kickoff and host an on-site event. A celebration helps again communicate the policy and could be a time where people who are trying to quit receive resources and supportive services. After the policy has taken effect, it is important to evaluate and check in on how things are going. A few ways to do this are conducting an employee or family follow-up survey, conducting an environmental assessment, utilizing a health assessment to determine changes in tobacco use, or working potentially with your health insurance to compare costs before and implementation of a comprehensive policy. To ensure you receive all of the free benefits offered by the Iowa Department of Health and Human Services, we are happy to assist in writing a policy that maintains its integrity but also fits your child care. We are also more than happy to look at your current policy and provide any recommendations that would make it comprehensive and meet state standards. To qualify for free signage and window clings, the policy must extend to the entire property and vehicles at all times, as well as the other items listed below. This checklist represents the Iowa Department of Health and Human Services gold standard for a comprehensive tobacco and nicotine-free policy. By having a policy that meets these standards, child care centers and homes can also be placed on the state-based registry that showcases they are tobacco-free businesses. This is a great way to be recognized for your efforts and also promote your business. Some other free resources that we can provide include free technical assistance with a policy change, eligibility to receive paid marketing to highlight the policy change, notification letters to employees and parents, and newsletter articles on cessation, tobacco cessation handouts, and incentive items such as quit kits, ice packs, stress balls, and other useful things for your child care home and/or center. It is important to note that all of these resources are free and provided as a direct result of our grant with the Iowa Department of Health and Human Services. Promotion is a great way to share the positive change your center and/or home is making and potentially draw in new families. We are happy to provide listing on our comprehensive tobacco and nicotine-free childcare center portal and listing internally, or create a social media ad boosted in your area. We will work to find what works best for you to promote your policy locally. Now let's take a closer look at the resources available to support quit attempts on the next few slides. The Centers for Disease Control and Prevention has found that nearly 70% of adult smokers are interested in quitting. Tobacco cessation programs offered at businesses as part of a comprehensive tobacco-free policy can help tobacco users achieve this goal of quitting. It is important to remember that tobacco users are addicted to nicotine, and this addiction is very difficult to overcome. Sensitivity to the needs of tobacco users is important as you provide resources to help them quit. Here are a few cessation options available in Iowa. The American Lung Association sponsors the Quit Now Freedom from Smoking online social support community on the Inspire platform. Through our online community, members have a social outlet and provide warm welcomes and emotional support, making the experience positive and friendly. By sharing stories, patients and caregivers and community advocates inspire and empower each other. We also have our lung helpline that's staffed with nurses and respiratory therapists to answer all of your lung health questions. Next, let's take a look at some external programs that are available. Quitline Iowa is a free tobacco cessation resource made available by the Iowa Department of Health and Human Services. All Iowans can access this program and its services. Quitline Iowa offers a quick guide that's sent to individuals who enroll with an easy-to-use workbook. Also, individuals are assigned a quit coach, which supports them over their quit journey and discusses any questions or urges or troubles that they have. Also, quitting aids are discussed to help decide if nicotine replacement therapies are right for the person. Also, potentially free nicotine replacement therapies are available for those who do not have insurance or do not have coverage for nicotine replacement therapies through their insurance. Individuals who have Medicaid and Medicare also have nicotine replacement benefits through their programs. Quitline Iowa also has a pregnancy-specific program that offers additional calls and resources both pre- and postpartum. There is also a financial incentive tied to completed calls for both pre- and postpartum individuals. A benefit is available up to $220 while this benefit is available. Quitline Iowa also offers My Life, My Quit, which is the teen-focused tobacco and vaping cessation program for 13 to 17-year-olds. It is important to note that all these programs support all forms of tobacco use to quit, whether that be smoking, smokeless tobacco, vaping, etc. Quitline Iowa, My Life, My Quit can help individuals quit for good. My Life, My Quit is a free vaping and tobacco cessation program for youth 13 to 17 years old. My Life, My Quit provides specialized tobacco treatment coaches who understand teens, provide support, and build relationships that promote quitting. Youth receive 5 coaching sessions via phone, live stream, or online chat. This program is free and confidential for teens who are looking to quit vaping, smoking, or using other tobacco products. To enroll, youth can text Start My Quit to 36072 or visit mylifemyquit.org and chat with a live coach. From there, youth can have the support they need to quit. Through My Life, My Quit, youth receives text, coping skills, and learn more about addiction and the support they need to quit for good. As I mentioned previously, Quitline Iowa has a pregnancy and postpartum program for those looking to quit. With this program, participants receive all of the general Quitline Iowa program materials, but with even more benefits. Those enrolled receive 9 coaching sessions with a dedicated female coach and a potential financial incentive of $220 in the form of Visa gift cards. This program is great to share with anyone looking to quit tobacco. Overall, it is important to protect yourself and your business from the effects of tobacco. Ways to do this are listed below. Enrolling in programs like Quitline Iowa, My Life, My Quit, or providing these materials at your business is a great start. Also, keep your home and house free of tobacco, including your child care center. Keep your car and company vehicles tobacco-free. Choosing tobacco-free housing, choosing tobacco-free childcare, and teaching children to avoid tobacco products. Also, modeling healthy behaviors all are steps we can take to create a tobacco-free future. So overall, a tobacco-free and nicotine-free policy protects non-smokers from secondhand and third-hand smoke, encourages tobacco users to quit, and creates a positive image for your child care. When implementing a policy, it is important to establish a comprehensive policy, educate employees and visitors, and post signage. If you're interested in moving forward with a policy change, the next step would be to contact us. We would love to meet with you individually and create an action plan that fits your business's needs. We are here to help you every step of the way and make it as easy as possible for you. We are also able to connect you with your local community partner if you are outside of our service area. If you have a current policy, we can get you on the state registry and let you receive free signage. Lastly, if you would just like tobacco cessation resources and/or support, feel free to connect with us and we can provide those materials to you as well. Thank you for joining our webcast today. Please reach out to the American Lung Association for any questions or concerns that you have. We can be reached by phone at 515-309-9507 or by email at beth.timmerman@lung.org or josie.redman@lung.org. Thank you and take care.